Namaskaram andi. I'm Dr. Ganesh Gorthi. I'm the head of the Department of Gastrointestinal Surgery, Robotic Surgery in Continental Hospital, Hyderabad. I'm a robotic gastrointestinal and bariatric surgeon. After completing my MBBS and Master of Surgery in General Surgery in Guntur Medical College, I had been to UK and US for higher surgical training. And I had completed my surgical training and I had returned to India to offer my services to the Indian public. I had been fortunate to complete fellowship programs in 3 different continents in Asia, Europe and North America in the fields of robotic surgery, bariatric surgery and American College of Surgeons. Since returning to India, I had been offering my services in the fields of robotic surgery, laparoscopic surgery and bariatric surgery, gastrointestinal surgery and general surgery. Today's topic is about robotic surgery and its importance and its application in the field of surgery. So, what is robotic surgery? Robotic surgery is the most sophisticated form of surgery to be offered to the patients to improve the patient outcomes following any operation. So, at the first outset, I would like to tell about the big misperception about robotic surgery among the public. People do ask me many times, is robotic surgery safe? Is the robot is going to act by itself with the surgeon losing control over it like it happens in the movies? I would say that it is completely wrong. It is completely a misperception. It is not true at all, because the robot cannot move even a single millimeter without the instruction of the surgeon. It is called master-slave surgeon, the surgeon being master and the robot being slave. So we can be completely confident that the robot is not going to be erratic and acting by itself without the control of the surgeon. The surgeon is in full control of the robot. And next most important thing is robotic surgery safe? That is also beyond doubt. It is established. It was established beyond doubt over the last 2-3 decades that robotic surgery is safe by multiple studies all over the world. Now, let us talk about robotic surgery. Why is it so great? Robotic surgery is so great because it combines the advantages of both laparoscopic surgery and open surgery. Like laparoscopic surgery, it is also a form of minimal access surgery. That is, we do the operation through small incisions, thereby reducing the complications of the wound for the patient. That is, less pain, less bleeding, less infection, and also reducing the stay of the patient in the hospital, and also hastening or quickening the discharge of the patient from the hospital back to home. And because the pain is less, the patient mobilizes much quicker after the robotic surgery than the open surgery. And he will be able to go back to his normal work, his job and education, all these things with minimal hindrance. And robotic surgery also combines the advantages of open surgery in that way that the robotic surgical instruments are much better than laparoscopic surgical instruments in their movement. So these are the main things, but there are many other advantages for robotic surgery. In robotic surgery, the vision is much greater than a traditional laparoscopic surgery, so that we can see much better. A magnified 3-dimensional or bifocal image we will be able to see. And as I mentioned before, the robotic surgical instruments have the dexterity, have the movement which is much greater than laparoscopic instruments. And robotic surgery also offers filtering the tremors of the hands of the surgeon, and also robotic surgery has 4 robotic arms, so that all are being controlled by the surgeon. So in effect, the surgeon is operating as if he had 4 arms. So all these combined, when you can see better because of the better vision, when you can move better, when you can move better because of the better instruments, that gives much better precision for the surgery. That means we can remove the exact point where we have to remove that organ with minimal damage to the surrounding structures. All this will translate into a better patient outcomes, lesser complications. That is the whole concept of robotic surgery. So is it all great about robotic surgery? Is nothing against it? Definitely there is one big disadvantage is cost. Robotic surgery costs more than traditional laparoscopic surgery or open surgery. But we are hoping that with the advent of time, with the advancement of the technology, the prices are going to come down even further, and then that will be more affordable for more patients in the future.